Hi, so I did my project on diabetes mellitus. Um, my grandfather had it, so I just already had a decent knowledge of what was going on, so I decided to do it on that. Um, so what is it? It's a form of diabetes that prevents your body from properly using the food you eat as energy. Um, it has two different ways that it can occur. The pancreas produces little to no insulin, so insulin is what's needed to help your body change sugars into energy. And the other option is the pancreas does create insulin, but it doesn't work properly. It's also known as insulin resistance. There's a lot of different causes of this form of diabetes. I didn't list all of them because when I was reading them, there was just way too many to put on this PowerPoint. But the ones that I know that are super common, obesity it's what my grandfather was, but obesity is a huge cause. Impaired glucose tolerance. You can have high blood pressure that can help cause it. A sedentary lifestyle, and then obviously family history, genetics, and age also plays a pretty big factor into it. There's multiple symptoms and signs you can look out for to tell if you might have this form of diabetes. Increased thirst and hunger is pretty common. Constantly needing to urinate, constantly going to the bathroom, rapid weight loss is a pretty huge sign. Fatigue and irritability, I feel like those go hand in hand. And then slow healing sores like lesions and cuts and bruises and all that, they heal super slow. Blurred vision and constant infections of like the gums and things like that constantly get infected. There's 3 different types of treatments for this. There's no known cure for diabetes or this form of diabetes. There's just no known cure. But there's different things you can do to help with the symptoms and other things like that, like oral medication. Usually that's for people who live a healthy lifestyle and have a good diet, but it's still just not enough. So they'll often prescribe some form of oral medication, and that helps ease symptoms, and it's usually a booster for your insulin. One of them, most common one, the first course of action is usually dietary management and physical activity. A lot of the times, if you're having this issue, if you have this form of diabetes, it can all be, I'm not going to say resolved or fixed, but a huge thing you can do is change your diet, eating healthy, cooking for yourself, anything like that where you're not taking in an unhealthy diet and you're just simply changing your diet, eating a healthy meals and being physically active and changing your lifestyle is usually the first way to go. But the one that I've experienced most of my life is insulin therapy. So my grandfather did. A couple people in my family have done this. You can either inject it manually or you can have an insulin pump, and every one of them wore it right here on their hip. And that's just the most common form of action I've seen with this form of diabetes is the insulin pump and I suppose insulin injections into the body. But other than that, there's really no known treatment. Just give a quick overview. It's pretty common in older people and obese people. A lot of things can happen to change and prevent it from happening, or even make it to where you're almost living without it, such as dietary management, physical activity. That helps a lot. And there is no known cure, but these are the 3 most common treatments, really the only treatments to help with it. Thank you very much.